Hey everyone, welcome back. We haven't done a Facebook Live for a while. Sorry, I'm trying to get myself centered a little bit here. I'm technologically challenged, but welcome back. We're still doing about a monthly Facebook Live to update you on anything recently going on with respect to COVID, the COVID vaccines, but most importantly to answer your questions, address any concerns, and so please feel free to throw questions at me and I will do my best to answer them. And please address your concerns. I think the most important thing about this illness is to counter the misinformation, disinformation, social media firestorms that are going on out there that honestly are a much more dangerous pandemic than the COVID disease itself, which is really hard to say. We are at a point that globally almost 1.8 billion vaccine doses have been given over the world, over 20 million doses a day, and they've been dispensed with very low rates of serious side effects. Yes, there are side effects with any vaccine, but you have to weigh that against what is your risk of adverse effects with COVID disease. And a recent study showed that over 72% of patients in a 10,000 person study had adverse effects, including severe fatigue, brain fog, shortness of breath, lung function changes, EKG changes, exercise tolerance issues, loss of taste or smell, loss of hearing, etc., up to 60 days after COVID illness. So I am still dealing with a lot of patients, I know my colleagues are as well, who are having long haul symptoms of COVID disease. So again, you got to weigh the possibility that you're going to have a sore arm and possibly some fever and flu-ish symptoms from a vaccine compared to getting the risk of getting COVID illness. Now, fortunately, because we've had over half the adult population in the United States is now fully vaccinated, so a large percentage of our high-risk people in the United States have been fully vaccinated. It's over 265 million vaccine doses. I mean, this is unprecedented. But we've had over close to, we're approaching 600,000 deaths from COVID since it hit us really last February, January, February timeframe. And we weren't even testing for it until middle of March because of our testing debacle. A lot of people are questioning whether COVID deaths were overcounted or undercounted. There are some reports now indicating that deaths due to COVID may be undercounted by a factor of half. So they may be double what the current reported numbers are. The U.S. alone, we experienced over 500,000 excess deaths in 2020 compared to 2019. That included increases in cardiovascular and stroke deaths, and we could say those may have been people resistant to accessing medical care when they needed it. Deaths due to Alzheimer's dementia, deaths due to diabetes all went up. Now, all of these could be reduced access to medical care, but all of these are also big risks for COVID-related mortality because it hits those patients harder than anyone. We know it hits the vascular system. It definitely hits people with metabolic disease, blood sugar issues, hypertension, and kidney disease at very, very high hard rates of mortality, morbidity. And interestingly, cancer deaths did not go up at all. So that maybe goes a little bit against the theory that this is, people not wanting to access medical care. Although, with cancer, there might be a more compelling, I see a lot of people downplay their chest pain and oh, it was just heartburn, and I just thought I'd sleep it off. A lot of people downplay their stroke symptoms because it's not painful. Cancer tends to be a little bit more scary, so people do tend to jump in, access medical care, pandemic or not, with a cancer diagnosis. So that could factor against that. And interestingly, suicide deaths were dramatically down 5 to 6% nationally during the pandemic. And that's an interesting thing, because certainly despair and depression and isolation were up. Alcohol use was up, but we're trying to figure out, people weren't taking their lives at the same rates. The country was pulling together a bit. We were all doing our part by trying to keep each other safe. And sometimes that kind of pulling together in the face of adversity is a mental wellness protective and helps us build a little bit of resilience. Now, as many of you have heard, and some of you have been a little bit upset about, the CDC did change its guidance not too long ago, saying that fully vaccinated people can resume activities without wearing a mask or physically distancing. And that is based on some excellent studies, especially out of Israel and elsewhere, that showed the likelihood of contracting COVID once fully vaccinated is extraordinarily low. In fact, a recent study showed 0.01% of fully vaccinated people tested positive for COVID. So yes, you can still get COVID infection after being fully vaccinated, but 99% of those hospitalized between January and April, this is in a study from the Cleveland Clinic, 99% of the hospitalized people with COVID were unvaccinated. So if you do get COVID after being fully vaccinated, it is not likely to be severe, and you are extraordinarily unlikely to need to be hospitalized. I will say that those who are immune compromised should continue masking while indoors where distancing isn't possible, or continue to avoid crowds. I mean, I don't know about you, but I will still mask in a grocery store or a shopping center. We all are required to still mask in medical facilities. I mean, think about it. We have lots of people who are immune compromised or on chemotherapy, et cetera, in a medical facility, or who cannot get vaccinated for a variety of reasons. We're all required to mask in transportation hubs, such as airports or on buses, trains, planes, public transit. We are all required to mask where required by federal, state, local, tribal, territorial laws, rules, regulations, and local businesses have the absolute right to say you cannot enter this business without wearing a mask. Here at Lifescape, we have several staff who are at very high risk were they to get COVID, and because of immune impairments, their vaccines may not be as protective as we would like. So we all, again, have to be thoughtful of not just ourselves and our own risk, but those in our community that we want to pull together and protect them as well. Unvaccinated people are at risk, so you're encouraged, if you choose not to vaccinate, that is fine, but you're encouraged to continue masking, distancing, because you're not only at risk of disease yourself, you're at risk of potentially, you're a potential reservoir for new variants of this virus that could then put all of us at risk again. And the last thing we want is to come up with a variant that renders our current vaccines useless and puts us back to square one, which would be disastrous. Fortunately, again, these vaccines that have been developed, based on 20 years of technology and able to be rapidly sequenced, so far testing phenomenal against a number of the variants that have popped up all over the world, including the variant from Great Britain, which is now predominant in the United States, including the South African variant, maybe not quite as good, but still quite good, the variant from Brazil, and the variant that's predominant and highly disastrous in India. These vaccines work really well, and so we just count our blessings every day that technology was developed over the last 20 years and has been able to be deployed and develop such effective vaccines with incredible safety profiles so quickly. Let's see, I'm trying to think what else. I want to just counter a couple COVID vaccine myths that I still hear on occasion from people. I too was very skeptical at the beginning that are these vaccines being developed too quickly, and are there shortcuts being taken? I am completely comfortable, having reviewed the medical literature in great detail, that zero shortcuts were taken in the development of these vaccines and the testing. The testing was able to be expedited because this technology was already in place for pandemic preparedness. It allowed sequencing. Once the Chinese did fess up and share the sequence of this virus, they were able to sequence these vaccines within weeks. I mean, miraculous. They had financial support so they could pursue multiple phases of these clinical trials in parallel instead of in sequence, which would be the normal process. And we had a large number of patriots who are out there volunteering to be in these trials, including many of our patients. We've got kids in the practice in clinical trials right now, and we had huge outbreaks of disease. So we had the ability to get large numbers of cases and controls very quickly, and get you have to hit certain thresholds of cases and controls to achieve clinical statistical significance of effectiveness and of safety. And so they were able to meet those things quickly because we had such I call them wildfires or tsunamis of disease, and we're able to get to those numbers very quickly. Also, the currently available vaccines do not enter your cell's nucleus or have any impact on human DNA. It is just completely not possible. The mRNA vaccines work in the periphery of the cell, deliver that little fragment of mRNA protein, basically recipe, get converted to the spike protein in the periphery of the cell, in the cytoplasm of the cell. The mRNA is immediately broken down, and the spike protein is posted on the outside of the cell, where then the immune system mounts its response. There's no whole virus involved. In fact, the only vaccine I'm aware of that is whole virus is the one being deployed in China predominantly. And actually, Chinese cases are down to next to nothing, which is very hopeful. If we don't eradicate this disease globally, it's going to be with us forever. So it's a global problem. It's not just a local issue. It's not like we can shut ourselves down from the rest of the world. Another myth to counter: there are no novel ingredients. I mean, the common lipids and things involved in these vaccines are, as common as Miralax. A lot of people take polyethylene glycol on a daily basis for their constipation. That is one of the carrier molecules in the mRNA vaccines. There is no fetal tissue in the vaccines. There are no microchips or implants in available vaccines. That is not credible. It is not possible to put any significant amount of metal in a 0.5 ml injection through a tiny needle. It's just not possible. It is impossible to get or shed COVID virus from any of the vaccines currently used in the U.S. You can catch COVID illness anytime between the first dose of the vaccine and 2 weeks after completing the second dose. In fact, in our antibody studies, which a number of you participated in, and thank you very much for those of you who were willingly poking their fingers and being guinea pigs for me in these vaccine trial studies of antibody response, showed us virtually no significant antibody development until at least 3 weeks after the first dose of a vaccine. So by the second dose, you might have close to 80% protection, maybe even a little bit higher, especially in younger people, which is why Israel currently is only going to do a single dose of the mRNA vaccine to their 12 and up children. So that's an interesting thing that we'll want to watch and see how effective it is, because that cuts your side effect risks in half, which that would be great if that's all that was necessary. But you're not fully vaccinated. We have picked up patients who their antibody response showed us they actually contracted COVID in the midst of their vaccination process. So they showed up with an mRNA antibody, or an antibody to IgM antibody, which means acute recent infection, to the nucleoprotein, which is not part of the normal vaccine response at all. So we've picked up a couple cases where people actually had COVID disease in the process of getting their vaccinations. And some of the severe side effects that we do hear about could in fact be people who've actually gotten disease on top of being vaccinated. Because, although certainly achy fluey symptoms, local discomfort, redness, soreness, swelling of the armpit, lymph nodes, sometimes even nausea, vomiting, in some patients even fainting or dizziness, those kinds of things are all potentially expected vaccine consequences. Cough, shortness of breath, loss of sense of taste or smell are not normal responses to the COVID vaccine. So if those symptoms emerge, I would definitely consider getting tested for COVID. Once you are vaccinated, if you are exposed to a COVID case outside of a medical setting, you don't necessarily have to be tested for COVID. I'd consider it if you're immune compromised or you are in close contact with people who are immune compromised. I would certainly recommend it for any of our staff who have a close contact, because again, if we were to get it, we potentially could transmit it and put a high-risk patient at risk. So, but if you're fully vaccinated and you do have a close contact that turns up COVID positive, you don't necessarily have to be tested. So that's encouraging. Let's see. Neither COVID vaccines nor natural COVID infection have increased rates of miscarriage or shown any adverse effect on fertility. That theory that again got blown up on wildfire on social media has been completely debunked. It is not even theoretically possible. And during the Pfizer vaccine clinical trials, dozens of women did become pregnant. And actually, if you did the VSafe vaccine follow-up program that the CDC had available. So again, I signed up for that after I got my vaccines, and every day for a week, and then every week, and now every month, I get a quick survey from the VSafe program asking if I've had any adverse symptoms pop up and if I've become pregnant, which, at this point we'd have to report that in the National Enquirer, but not likely to happen at this point in time. But they're really trying to track these things very, very carefully. And, I have to say, pulling the J&J vaccine after less than one case per million of a rare blood clot complication, is above and beyond, safety. They're really, if there are severe complications, they are checking them out, and they are checking them out thoroughly. Right now, there are about 55 case reports of a mild heart inflammation symptom presenting in kids who've gotten the COVID vaccines. So a couple of those kids have been hospitalized, and none have had anything severe happen, no deaths, all are self-limited, they resolve on their own, but that is being very, very closely evaluated as potential vaccine side effects. Again, heart inflammation is definitely something that people can develop after COVID illness. We are seeing a lot of abnormal EKGs, exercise intolerance, abnormal lung function tests in post-COVID patients. So, the vaccine might cause some risk, but so does the natural disease. So again, you got to weigh those risks and talk it over. I can't emphasize enough. Please talk this over with a medical person that you trust. There are doctors out there that are spouting disinformation, misinformation. It's hard to know who to trust out there, and I totally understand that. But boy, we really, really try hard to evaluate all of the data, to evaluate what's published and credible, and just help you sift through that. We're all inundated with information and starving for wisdom, drowning in it. But let your medical professional help you guide through your risk-benefit equation if you're still on the fence about whether to get vaccinated. Some people ask whether they need to get the vaccine if they've had natural COVID. A study recently out of Washington University, my alma mater, and my husband's and one of my daughters now, showed that natural immunity from COVID is pretty darn good, maybe up to a year or more. Now, what we've seen in our antibody studies, which we've been doing since March of, the antibody studies are showing widely variable antibody response to natural COVID infection. So it's kind of all over the map. I think a lot depends on what kind of viral load you got and how healthy was your immune system to start with, etc. So, and we know that vaccination boosts that neutralizing, the true blocking antibody response by 50-fold. About at least a third of patients with natural COVID infection will have no neutralizing antibody response. There are some arguing that a single dose may be sufficient in those who've had prior COVID. And I have some patients who are opting to monitor their antibody status and defer vaccination until their antibodies look like they're waning. And that's a perfectly reasonable option to consider. So, but I'd still be cautious in the interim, particularly those who've had monoclonal antibody infusions, which are like getting an army of COVID antibodies in a single IV infusion. In those cases, it's really, I would definitely wait at least 90 days to get your first COVID vaccine. And like I said, some are opting to monitor their antibody status or their neutralizing antibody status and defer vaccination until that looks like it's waned. Because if you give a vaccine on top of an already robust antibody status, you might have a little higher risk of more adverse effects than normal. I think that's all that I really have. Are there any questions that have popped up today? So I'll just spend another minute or so just to tee up a webinar that I'll be doing. Oh my gosh, now I forgot the date. I think it's, and we'll be sending out announcements about this. And this is on my new book called Secrets to Surgery Success, Take Charge and Heal Faster, with a goal of really helping people think about surgery as something, as an athletic event that you want to train for. And everything that we discuss in that webinar are also things just that are helpful to boost our own immune system, to help us deal with coming up against a cancer, which is another big athletic event that, you know, all of us are highly likely to face at some point in our lifetimes. To all of these are things that help shore up our brain function and hopefully help us defer aging. You know, our goal overall is to die young at a very old age, as my mentor Mark Hyman likes to say. And you know, as I told a patient this morning, my goals in caring for patients are not as much around longevity as they are improving health span, the number of years you live without death or disability. I don't want any of our patients to develop type 2 diabetes because I feel like it's entirely preventable. I don't want any of our patients to need vascular surgery because, again, that's highly preventable. I don't want a single patient to outlive their brain, nor to need dialysis. All of those things we should be able to stave off for a very long time. And right now, the U.S. ranks extraordinarily low, I think 28th in the world in healthy life expectancy. You would do better in Cuba, Uruguay, a lot of other countries. And that's a pretty sad statement, given that we're spending more than double virtually every other economically advanced nation on healthcare. So, you know, our goal is to be preventive, proactive, and empower you with the tools to improve your health and improve your health span and live longer with a much better vitality and less disability, less dependence on a slew of medications. So I hope you'll join me for that. Please feel free to spread the word. I think our team has put the webinar information up on the Brilliant Health page. So please spread the word for us. Anybody is welcome to join this. So if you can think of anybody who might benefit from this, who's coming up against a cancer, who's looking at the possibility of surgery in the next year, you know, who's interested in taking charge of their health rather than cruising through life as a passive victim, as many of us, you know, I think our system kind of conditions us to do. Oh, let's just throw a pill at that. Let's just, you know, we'll just cut that out. Well, you're not, if you're not getting to the roots of it, you're going to be doomed to endure the consequences of failing to address those roots, and it will pop up. It's like playing whack-a-mole. You may beat down that diabetes with a drug, but then it's going to pop up in dementia or cancer risk or cardiovascular complications down the line. So that's my goal. I appreciate you guys for hanging in there with us and spreading the word, and stay well, be healthy, keep being careful, but enjoy those smiles, those hugs, and getting back to some semblance of normal. Have a great Memorial Day weekend and enjoy. Be safe.